medicare.gov has a new plan finder tool, and today I'm talking a little bit about this new tool, how it works, and how to use it to find the best Medicare Part D drug plan for you based off of your specific needs. So stay tuned. Medicare.gov is launching a new plan finder tool. They want it to be kind of a streamlined way that you can access all of your Medicare benefits. There are some pros and cons to it, so I'm going to talk a little bit about those today and show you how you can start using this tool if you want to search Medicare Part D drug plans that would be the best for you. So I'm going to hop on over to the new plan finder tool here, and it will give me the option right away to log in or to continue without logging in. So if you have a mymedicare.gov account, you can log in with that information. If you don't, then this button will prompt you to create an account. There are some benefits to logging in with your mymedicare.gov account on the Plan Finder tool, especially if you're searching for Medicare Part D prescription drug plans. They do have this option where they can use your personal information to actually pull up a list of the medications that you've been prescribed and medications you've been taking recently, so that you can just import those and search for drug plans based on your current drug list. For the purposes of today, we're just kind of doing a basic overview of this new plan finder. We're going to go ahead and continue without logging in to show you how that works. So I know that I'm wanting to search for Medicare Part D prescription drug plans. So I'm going to say View Plans. I know what type of plan I want, and I want Part D drug plan. And I'm going to go ahead and enter in my zip code. I'm going to enter in a Travis County, Texas zip code. Do you have your Medicare number? They're letting you know that you will need that if you want to use this plan finder tool to enroll. I'm going to click no. And then it's going to ask me to enter in my date of birth. I'm going to enter in date of birth here. And it will tell you about what type of enrollment period you're in, if you're in your initial enrollment period, or maybe it's the annual election period when everyone can shop their drug plan in the fall. That's from October 15th to December 7th. So during that time, October 15th to December 7th, you can hop on over to this Plan Finder tool and you can enroll in a drug plan for the following calendar year. It's going to ask me if I get help from one of these programs. I'm going to say I don't. Do you want to see your drug costs when you compare plans? Yes, you always want to be able to see your drug costs when you compare plans. This is important in helping determine which plan is going to best cover your specific meds. I'll say that I normally fill my prescriptions at a retail pharmacy, and then I will go ahead and start typing in the names of my medications. So I'm going to do this search just with a few generic medications that are very popular. Let's say lisinopril is one. Let me choose which dosage I take, how many I take every month. I can add that to my drug list. I'm going to add another drug. Let's say I take pravastatin, and I'm going to add it. I take, let's say, a 20 milligram tablet every day. And for the sake of today, I'll just add these two. I'm going to click done. It will give me choices of pharmacies that I can select that are local to my area. And you can select a few different pharmacies. I'm going to select two today just to compare drug costs at these two pharmacies. And then it's going to bring up all of the different Medicare Part D prescription drug plans available to me. And it'll give me different ways to sort them. I can sort them by lowest monthly premium, total lowest drug cost, and lowest yearly drug deductible. Now this is one change with the new Plan Finder that I'm not thrilled with. Prior, you would be able to sort plans by total lowest remainder of the year costs. And what that did was it would give you a total cost when you include the cost of your monthly premium of the drug plan, which is listed over here, plus the cost of co-pays that you're going to pay for all of your medications. It would add all of that together, and that would be the default for how it would organize the drug plans. It doesn't really do that anymore. So it gives me different ways to organize them. I can either organize by lowest monthly premium, so lowest total monthly premium for the drug plan, or I can sort by lowest drug cost. Now, this shows me which drug plan has the overall lowest cost for my medications, but it's not factoring in the cost of the drug plan along with the cost of the medications. And then I can also sort by lowest yearly drug deductible. Now, you'll see here that this plan, for example, has a $0 drug deductible, and it shows that my estimated yearly drug cost is actually $0. This plan is $67 a month, though. If I sort by lowest monthly premium, I see a plan that has a $415 drug deductible, but my estimated retail pharmacy costs are $0. Well, how is that? Drug deductibles on Medicare Part D drug plans often only apply to higher tier or brand name medications. So most drug plans have a deductible. There are a few drug plans that have $0 drug deductible, but most plans do have a deductible. But it's important to know that this deductible usually only applies to higher tier or brand name medication. So my lower level generics, I'm not having to meet the deductible for that. So let's take a little bit closer look at this plan. I'm going to click on plan details. This plan is $10.40 per month, does have a $415 drug deductible, and it's going to give me my costs at two different pharmacies. Walgreens is up here, CVS is down here. If I went to Walgreens, I would be paying, before the deductible, $2 for my lisinopril, $3 for my pravastatin. If I go down to CVS, cost before deductible, I'm paying $0 for both. So this plan would be a little bit better fit for me, right? Because it's only $10.40 per month. It does have a $415 drug deductible, but if I use this pharmacy, it's $0 copay. In general, this new plan finder is a little bit more difficult to navigate when it comes to looking at the total overall lowest remainder of the year drug costs. But what you really want to take into consideration when you're looking at these plans is the monthly premium of the plan and what your estimated yearly drug costs would be. Essentially, you want to add those two numbers together to figure out which plan is going to be the best fit for you. So you can see these more expensive drug plans, this one is $21 a month, doesn't necessarily mean that I'm going to pay less for my medications. This plan, I'm going to pay more for my medications, even though it's a higher cost plan than that lower premium plan down here. So in general, this is the way that you can search. I would recommend looking at the monthly premium and the retail pharmacy estimated yearly drug cost to determine which plan is going to be the best fit for you overall. Another thing I wanted to note is that you can filter plans up here. You can select plans that have, let's say you want a minimum of a 3-star rated plan. You can go ahead and select that. If you want a plan that's accepted everywhere across the United States, there's an option to select that as well. You can apply those filters and view different plans. You can also use this tool to go ahead and enroll directly, and it will let you know the information you need if you want to enroll. You'll need your Medicare number, information about any other type of drug coverage you may have, and dates that changes take effect. You can go ahead and start and finish the enrollment process. This is the same Medicare Health and Drug Plan Enrollment Center that has been used prior. It asks the same questions, and we've walked through this process on a couple other videos. This has been just a real brief overview of this new medicare.gov plan finder tool as it is used to shop Medicare Part D drug plans. There may still be some changes happening to it. We'll keep you updated along the way. Thank you so much for watching. If you ever have any questions, please let me know. Doing Medicare Part D prescription drug plan policy reviews is something we do for all of our clients every year. But if you want to start playing around with this plan finder tool on your own, I hope that you found this video helpful. Please feel free to reach out with questions at any time. Again, thank you for watching, and we'll see you soon.